Hi, I'm Dr. Lisa Arthur from Health and Balance in Laguna Beach, California, and today we're going to talk about brain health. And brain being the very largest organ of control in your whole body. It controls cognitive skills, memory, balance, your immune system, endocrine function. So one of the ways that you can assess your brain chemistry is a forum that asks you questions about your brain health. There are questions on there about memory. What did you eat 3 days ago? There's questions on there, cognitive questions. Can you count backwards from 100 by 7? There's questions on there about balance. And that will assess your brain in many ways. Also, if your brain is fatiguing more now than it used to be. Let's say you work an 8-hour day, and you remember 5 years ago you could work an 8-hour day and you weren't tired. Now you work an 8-hour day and you come home much more tired, not able to get anything done at nighttime. Maybe driving fatigues you. Maybe being in front of a computer more than 2 hours fatigues you. Anything that fatigues your brain shows that in some way your brain is not functioning at an optimum level. So the other way that we can assess brain is also by looking at how your blood pressure is. If your brain needs oxygen, it needs oxygen all the time. And if your blood pressure is either too high or too low, that means that your brain is not getting enough oxygen. So by taking a simple blood pressure test, we can tell your blood pressure is a little high. That means you're probably not getting enough blood to your brain. Or the reverse can be your blood pressure is too low and you're not getting enough blood and oxygen to your brain and nutrients. One test that you can do yourself at home to see if you're oxygenating the tips of your toes and your fingertips, which is also your brain, is you can just do a simple nail bed test where you just pinch the tip of your nail bed and see if the pink returns quickly. Then that means that your capillaries in your tips of your toes and your fingers are functioning and doing what they're supposed to do, which is oxygenate. Another thing you can do if your nails are unhealthy, if there's fungal growth in your nails, that's another sign to tell you that, I might not be oxygenating as well as I would want to for my brain health. Another way that you can keep your brain extremely healthy is by keeping your glucose levels balanced. And there's a tendency these days for people to be either a hyperglycemic or a hypoglycemic. Well, what does that look like? Well, a hyperglycemic would be somebody that when they eat, they notice that they want to go to sleep within 15 minutes, a half an hour after they eat. They're tired. Opposite would be a hypoglycemic. Somebody that gets shaky, jittery before meals. They have to eat every 2 meals. When they wake up in the morning, they don't feel that good, or they actually wake up at 4 o'clock in the morning or 2 o'clock in the morning and they think that it's because something woke them or they have to use the restroom. A lot of times when people wake frequently at night when they're sleeping, it's because they are hypoglycemic. So again, for brain health, we need H2O being circulated through the brain all the time correctly with no vascular problems. We also need blood glucose that's at good, healthy levels. The third thing you need is essential fatty acids, raw nuts and seeds, oils from coconut oil, oils from deep water fish. Also, some of the things to think about with oils, we have a tendency in America to have a lot of corn oil, soy oil, safflower oil. Those oils have raised so much in our diet that it seems like we push a lot of those other oils that we need more of an abundance of out of our diet. Another thing you definitely want to avoid with brain health when it comes to oils is fried foods. Another way we can assess brain function is to go get a blood chemistry done. What we look for brain health is we look at vitamin D levels. We look at your glucose levels. You should be fasting. And we're looking for, again, a hypo or a hyperglycemia. And that is something that if you do have either one of those things, that is easily remedied just with some diet and lifestyle changes. Another thing we look at on blood chemistry is homocysteine. If homocysteine levels are high, it means that your body is not methylating. And that is something that's easy to solve too by just giving you supplements that help you methylate. If you're not methylating, another thing that happens happens with homocysteine levels that are high. It's very bad for your cardiovascular system, and it's definitely known to increase cardiovascular risk with a stroke or a heart attack. I have a couple things here that are specific to brain health. One of these products helps oxygenate your brain. It is a known supplement that helps your body grab onto oxygen, have it in the bloodstream, and circulate it all throughout your whole body. Another product that we have too is called Phyto E Brain, and what it has in it, it has phospholipids, and it also has a high DHA, and DHA is known to help your brain, whereas EPA is a little bit more for your immune system. Both of these products, Temero and Resveratrol, are both very anti-inflammatory. They are known to help with any inflammation that you have going on in your brain. For instance, if we have anybody come in that has just had a head trauma, what you want to always do as a practitioner with somebody with a head trauma is bring down the inflammation as fast as you can. And all these products will help bring down inflammation. Vitamin D is another supplement that if you're low on, it will affect brain health. And so if you know that you're low on vitamin D, it is a good idea to add vitamin D back into your diet, whether in supplement or in food. So those are just a few ideas for brain health, and if you have any more issues that you want to consult with one of the doctors at Health and Balance, please do so. Bring your concerns to us, and we hope we can answer your questions. Hi, I'm Dr. Lisa from Health and Balance in Laguna Beach, California. And today I'm going to talk about the adrenal glands. Adrenal glands are part of the endocrine system. The endocrine system is a system of organs that work in conjunction with the brain to regulate hormones in your body. And the job of the adrenal glands are they make cortisol. I'm sure you've all heard of cortisol. Cortisol helps you with your immune system and helps regulate your blood sugar. They also make mineral corticoids, which are hormones that regulate your minerals in your body. And they also make sex hormones, testosterone, estrogen, and progesterone. There are symptoms that go along with your adrenals if your adrenals are not functioning well. So if you have any of these symptoms, you know, maybe something is up with my adrenal glands. And some of those symptoms are an immune system that's functioning poorly, slow starter in the morning, not sleeping well, whether that means waking up in the middle of the night or not falling asleep easily. Another symptom is if you're sitting and then you go to standing and you're feeling dizzy, that is a sign that your adrenal glands are not working well at all. If you come into the office and you suspect that your adrenal glands are not functioning well, maybe you've gone through a series of stresses in your life, a divorce or a move or a loss of job or a loss of a loved one or just long, chronic, repeated stress. Those are things that can stress your adrenal glands out. Other things that can stress them out are not getting enough sleep, having been sick repeatedly, not keeping your blood glucose in balance, whether you're not eating in the morning and you're just living on a cup of coffee or eating a lot of sweets, the regular American diet. So those are some of the things that will stress your adrenal glands out. So if you do come into the office and you suspect that something's up with your adrenal glands, we can do a couple simple in the office tests. We can take your blood pressure from a sitting and then to a standing position, and if your blood pressure drops dramatically, we know that your adrenals are stressed. Also, we can do simple blood tests, and if we see on your blood test that sodium is out of alignment, potassium, chloride, things like that, we can suspect that your adrenal glands are not working as well as they can. If you suspect your adrenal glands are stressed, some of the very simple things that you can do at home are getting enough rest, keeping your stress to a minimum, and doing things that you enjoy, hobbies, walking on the beach, getting exercise. Keeping your blood glucose in line is one of the most important things that you can do. If you're a type of a person who is a hypoglycemic, meaning you wake up in the morning and you don't wake up refreshed, you crash in the afternoon, you get shaky before meals. Some of the most important things for you to do to keep your blood sugar regulated is to eat in the morning, not have more than 12 hours between dinner and breakfast, eat small, light meals every 2 hours. Then if you're a type of a person that's more of a hyperglycemic, which means you have a tendency to get tired and sleepy after meals, the things that you need to do to keep your blood sugar in line are stay away from simple carbohydrates, which would be sugars, anything that's starchy and white would be more of a simple carbohydrate. Stay away from those and add into your diet more fat and more fiber. And we've talked a lot before about good, healthy fat, raw nuts, avocados, salmon, things like that. Incorporate those into your diet with healthy oils, olive oil, coconut oil, and those things will keep your blood sugar much more regulated. And once we have done an assessment on your adrenals, which can also include a salivary index test, which takes your adrenals in a window picture of a day, in 24 hours, we will take saliva samples from your adrenal glands and we can see where your cortisol levels are and then assess what kind of actions that you need to take to bring your adrenal glands back to health. Another quick little note about adrenal glands, that's something that you can do at home to kickstart your adrenals into working better, is when you wake up in the morning, within the first half an hour of waking, if you can do 10 minutes of high intensity exercise, it kickstarts your adrenals and your cortisol levels up high. Cortisol levels are highest in the morning. By 8 o'clock in the morning, they are the highest, and then they start to taper off during the day. When they taper off, it allows in the evening for your melatonin levels to rise. Melatonin makes you sleep well and sleep through the night and sleep restfully. So in the morning, within half an hour of rising, if you can do 10 minutes of high intensity exercise, and that would be jump rope, getting on an exercise bike and getting your heart rate up, doing some lunges, and doing a fast treadmill if you have a fast treadmill, anything that's going to get your heart rate up. If you can exercise and talk, that's not low intensity. You want to be able to be at a heart rate where it's difficult to talk. That is more of a high intensity workout. So again, if you have any question about your adrenal glands, come on into the office at Health and Balance. We'll be sure to help you out. Thank you.